Anything you would like to add, Ed?
Mr. Long?
Sure. Sorry for jumping ahead on the CBAS agenda.
It was a nice warm-up. We're all good. Go ahead.
I was just going to explain at that time that, again, via an interagency agreement with DHCS, part of our role with regards to the CBAS program and quality for people enrolled in CBAS is that we do have the responsibility for certification of adult day healthcare centers, licensed centers as CBAS centers. We provide a great deal of technical assistance, not only to providers, but also to managed care plans in understanding the benefit and in identifying issues for resolution and working to resolve those issues. One of the things that we do at the Department of Aging is we keep a dashboard on our website that identifies where CBAS centers are and are not located to help with the monitoring of access across the state, as Mary mentioned. And we are really focused through our efforts in trying to ensure that we make available, from our perspective, participant data, ADHC, CBAS Center data that's self-reported is available to assist in that discussion.
Thank you. Mr. Ogus, did you have anything from Finance?
Nothing to add, Mr. Chair.
Thank you. Ms. Kerstawani, anything from the LAO's office? Thank you. I really only one question on this. Thank you, all of you. There's a gap that needs to get reconciled. I heard that several counties don't have a single center, and then I heard that there's capacity in the program. I'd like to understand more clearly, what is real, but more importantly, if it just means that some counties have capacity and then counties that have a greater need have no capacity, is there a way to just meet the need? I'm just thinking in a bottom line way, how do we meet the need? I took a course once in graduate school that said how to lie with statistics. So I don't want to just talk about numbers and say that these are what the numbers say. I want to figure out how we meet need. So I'm going to ask Ms. Mildred and Ms. Cantwell if you'll both, speak to how we reconcile the apparent gap in the numbers that you reported.
Sure.
Bottom line, how do we actually make sure the service gets to be where it's needed?
Thank you. We have prepared this very complicated thing to reconcile these numbers and to understand, drill down on how it really impacts people. So we have prepared a 16-page written analysis, which I am very glad to provide to you. The basic.
I'll take the one-page summary.
I have that too. The basic issue with the numbers is that the California Department of Aging started tracking at the request of the Assembly Aging and Long-Term Care Committee the impact on the system from the date of the elimination, and the Department of Healthcare Services, as I understand it, started tracking from the date that CBAS became a managed care benefit a year later. So our point is that the whole thing matters. And to answer, and there are method problems which I will provide to you, but you've grasped the issue. If there is center capacity in Los Angeles, it really does not help a person in Sonoma whose center closed at all. And, the whole point of this is people stay in their homes and in their communities. So the answer to your question of how do we meet the need is what keeps me up at night, because the most clear and logical way to meet the need is to stop the bleeding. It is stop the fact that the centers are closing. And the most important aspect of that is the rate. There is a question of how do we build CBAS capacity in all of the many counties that now don't have it. And that's another question when it costs, there's a startup cost. But, the most important thing is not to get further behind.
Certainly. So just a couple points of clarification, and I don't think we disagree on this point. Prior to the elimination of the ADHC and the conversion to CBAS, the service was also not available statewide. It is dependent on where people want to open facilities. And so there are other services that are available to individuals, and health plans are required to ensure that people have the services they need to stay in their home. So it's my understanding, and certainly we can make sure we agree on this, that there have been 2 counties that used to have centers that have now no longer have them, and that's Sonoma and Stanislaus. And certainly what's happening there, and they each had 1 center. Just want to make sure I'm getting my head to. Okay. So what's happening there is that the health plans have a requirement to make sure that similar types of services are being made available to these individuals, and most importantly, that individuals are being able to get the services they need to remain in their homes. And so, certainly we think CBAS centers do an excellent job of providing services to individuals. It's not the only way that individuals can remain in their home and receive the kinds of services that they need. So it's really a full spectrum of covered benefits that provides that. So I don't think we would, absent the 10% reduction or anything, that we would have seen statewide build of CBAS centers. One of the reasons that is that there are specific requirements about transportation when it relates to CBAS services. And so it doesn't really necessarily make sense to have a center in the middle of a very rural area because there isn't enough individuals who require that service. And so it's how do we make sure that there are the services that are needed being provided, whether it's in rural or urban areas, but not necessarily, they don't necessarily have to be CBAS centers, is what I would say.
So what is the plan for matching availability of service with whatever the percentage of need is? What is the plan for doing that?
So it's what our health plans are already doing. They look at whether they should be referring individuals to the county to receive IHSS services, their other home health services, and working with other supportive providers. It's not it's different for each individual. It's not that there's a single answer to what is needed. We've talked about MSSP. MSSP sites actually can provide some of the things that we're talking about here. So I don't think there's a single answer. And certainly we continue to look at it, particularly in the 2 counties where there have been the loss of any centers at all. How do we make sure that individuals are getting the services that they need? And we're continuing to work with our health plans on that.
Let's hear from the public and see what issues they might raise. Public comment. Speakers will have 1 minute on this issue.
Sure. Gary Passmore, Congress of California Seniors. Let me give you a little bit of perspective within my 50 seconds remaining. We cannot design a program by looking in the rearview mirror, which is what I hear us doing here. Modest calculations based on demographic projections from the state's Department of Finance suggest that we're going to need spaces for about 300,000 people who need these services based on the numbers that we serve today. And I don't hear anybody talking about preparing for that capacity. If it's going to be in skilled nursing facilities, we need tens of billions of dollars to do it. And that's the one the feds require us to provide if we don't have alternatives. Thanks.
Thank you. Any other speakers? Just one other question. Ms. Laurel spoke to the rate cuts, and what has the governor proposed as it relates to anything that looks like any even partial restoration of rates that have been cut?
Thank you, Mr. Chair. We don't have a proposal on rates on the AB 97 rate cuts in the governor's budget.
I guess I'll then ask it this way. Given the recognition that the rate cut has contributed to closure of centers, and I believe the number is how many?
51.
51 centers out of how many?
243 is the remaining number.
Got it. About 25%, if I got the math right.
It's upward around 18% of the network has closed.
18%. And do we have any projection about the number of people who've lost service as a result?
There are several factors contributing to the closures and the loss of services. The number of people between 2011 and 2013 fewer people are 9,454.
So just under 10,000
That's right.
individuals have lost service. What plan for finding ways to provide that service alternatively or to restore that service at some level?
Sure. So I just want to be clear that at least a portion of that group, and again, our numbers also from 2011, so we can certainly make sure that we understand where our differences come from, is 5,000 individuals were reassessed as not being eligible for CBAS services. So I want to be clear that it's not necessarily linked to not having access to a provider, but there were eligibility standards that were changed to ensure that the individuals receiving these services were those who are in the most need for them. And so, calling it lost access is maybe not because of the closure of providers. And really the place where we see people having lost access to those specific services are in the 2 counties where the centers actually closed and there isn't the capacity to have others. As I mentioned earlier, and certainly we did this in the initial determination of the 10% rate reduction, again, within the authority that the department is granted to first, there were areas of the state where we didn't apply the 10% at all in the CBAS program. And then again, as over time, certain areas have called into question whether the capacity of the centers or the ones that were remaining open would be there'd be sufficient capacity for the beneficiaries who needed it. We have also done that exemption. So the places where the cut remains are places where there is excess capacity.
So I'd like to give you an opportunity to get together on your numbers.
Sure.
I'd like to hear from you again about whatever the number of individuals is who need service, and most importantly, how we provide that for them. I am very curious to hear what the evaluation of those who you said have been directed to another service. I want to hear an evaluation of how well that new service is meeting their need, just because I don't want it to be the case that we saved a little bit of money by moving somebody into a service that does not meet their particular need. So I'm going to give you a chance to get together on your numbers.
Absolutely.
And look forward from hearing from you again.
Absolutely.
Thank you.
Thank you.
We're going to move on to some issues related to Department of Public Health, licensing and certification program estimate and proposals. I'd like to call forward Jean Iacino, Scott Vivona, Maria Gutierrez, from Finance, Kimberly Harbison, and Jamie Metallica, and from the LAO's office, Sean Martin. Iacino,
yes.
Good
afternoon, Mr. Chair.
We are ready. Thank you.
We are ready. Thank you. I propose to just give you the brief overview of the program that was requested and just move right on into answering the questions posed by the committee. Thank you. As you mentioned, I'm Jean Iacino. I'm the Deputy Director of the Center for Healthcare Quality in the California Department of Public Health. And we, within the center is the Licensing and Certification Program. Licensing and certification licenses 30 different types of healthcare facilities and agencies so they can legally do business in California. And via a contract with the Federal Centers for Medicare and Medicaid Services, we verify that healthcare facilities meet certification standards to receive Medicare and Medicaid or Medi-Cal funding. We also investigate complaint and entity-reported incidents regarding concerns expressed about care provided in health facilities. We license nursing home administrators. We certify nurse assistants, home health aides, and hemodialysis technicians, and we oversee the training programs for these categories of certified individuals. We investigate complaints against these individuals that involve allegations of abuse, neglect, misappropriation of property, and professional misconduct. And we provide the Health Facilities Consumer Information System on our website that provides consumers with information about licensed long-term care facilities and hospitals throughout California. In order to estimate the workload and the resources needed by this program, each year we produce, as required by statute, an estimate of the licensing and certification activities and the resources needed to perform them. And our estimate does this for each facility type, and we use a basic formula that counts or estimates the complaint workload multiplied by standard average hours to complete a certain type of activity. And for surveys, we multiply standard average hours by facility type counts and by the required frequency of that activity. So in the last year, our methodology for calculating our estimate has not changed. However, we did make substantial changes into critical data inputs into the methodology. This year, first of all, we changed how we compute standard average hours for any activity type. In the past, we calculated the time spent on complaints and entity-reported incident investigations based on the date that our surveyor exited a facility on an investigation. This year, we used the date that the investigation was actually closed out in our database. This change captures workload for the surveyor to write up findings to fully complete the investigation after exiting a facility. Secondly, we changed how we estimate the number of complaint and entity-reported incidents we expect to receive in the coming year. In the past, we did this estimate based on the number of complaints in the prior year that showed hours worked on these investigations. This year, we based our estimate on all the complaints and entity-reported incidents that were received in the prior year. This captures, therefore, complaints and entity-reported incidents that were received but not worked on. And in addition, for the first time this year, we added a component to the estimate to reflect all of the complaint and entity-reported incidents that were open as of June 30th, 2014. And this change captures, for the first time, open aging workload carried over from the prior year. Based on these changes to our key estimate data inputs, our November 2014 estimates indicates that the licensing and certification program requires additional funding authority and staff to complete our mandated workload, including completing the open aging investigations. We will continue to review and refine our L&C estimate data inputs and methodologies moving forward. In particularly, we continue to look at our timekeeping system to improve our ability to accurately assess surveyor time and staff needed to complete various types of workload. Based on what the estimate workload projected and the necessary resources, the program has 4 budget change proposals. Our first budget change proposal is for increased funding for Los Angeles County. Our proposal is $9.5 million from the Licensing and Certification Special Fund to augment the LA County contract and to fund current contract positions and to fund an additional 32 contract positions. Our second budget change proposal is for Los Angeles County on-site monitoring and quality improvement. This proposal seeks an additional 3 positions and $378,000 from the L&C Special Fund to provide on-site oversight and improve the efficiency and effectiveness of Los Angeles County's contracted licensing and certification. Our third proposal seeks one-time funding of $2 million from the internal departmental quality improvement account to contract with vendors to enhance our internal business practices and quality improvement efforts to address some of the recommendations from the contracted assessment report of our program. And our final proposal seeks an additional 237 positions at a cost of $19.8 million from the Licensing and Certification Special Fund to address the workload identified in the estimate for the state. So move right on into the questions. There was a question about the number of the requested positions that are limited term. The limited term positions will focus on investigating aged complaints. To maintain the investment that we make in training for people hired into these limited term positions, the department will transition limited term employees into permanent positions as those permanent positions become vacant due to attrition. In addition, we would remind you that the department updates its estimate every year, and each estimate will provide up-to-date information on workload and resource needs. Addressing steps the department has taken to address Bureau of State Audit's issues and the assessment report that we received last year. We've taken numerous steps to address all these issues. Most significantly, our budget change proposals that I just described for you will substantially increase funding and staffing to accomplish our workload in a more timely fashion. In addition to the budget change proposals, ongoing activities include developing performance metrics on the volume, timeliness, and disposition of long-term health facility complaint and ERI investigations. We post these metrics quarterly on our webpage. We most recently posted in February 2015, and our next quarterly posting will include a breakout of these performance metrics by district office. And we are currently using these metrics as a management tool. We have modified our data collection processes to improve the tracking of the timeliness of open investigation complaints against certified nurse assistants. We are developing and updating written policies and procedures to ensure appropriate supervisor review and reduce variability among district offices. This is an ongoing process to address a particular issue raised by the Bureau of State Audits. We are developing criteria for reviewing complaint and ERI prioritization and the quality of investigations, and we're currently reviewing monthly a sample of complaint and ER investigations in Los Angeles County. By October 2015, we will use these criteria to monthly review a sample of the investigations conducted in district offices statewide. As of December 1st, 2014, we had filled 15 of 18 new positions that were established in the fiscal year 14-15 budget to improve the timeliness of the investigations of complaints against certified nurse assistants. Also, our branch chiefs conduct quarterly visits to each of the district offices to ensure compliance with policies and procedures, including those related to complaint and ERI closures. During these visits, our branch chiefs discuss investigation monitoring with supervisory, administrative, and management staff. In addition, we have developed and posted on our work site a detailed work plan to address the 21 recommendations that were in the Hubbard Assessment Report. And this work plan includes priorities for the 21 recommendations and a timeline, and we update it with activities to date. Some of our most recent activities related to Hubbard Report implementation include holding 3 public stakeholder meetings, developing a strategic map that is currently posted on the website for stakeholder review and comment, increasing oversight and supervision of the Los Angeles County contract performance. We have a retired annuitant and 2 of the 3 budget-requested positions already working on site in Los Angeles County, creating a data integrity group to ensure the quality of our data, developing a scope of work for a contract for recruitment and retention of nurses, recruiting for stakeholder liaison and a communications specialist. We are nearing completion of a business process redesign for our Central Applications Unit and our Professional Certification Branch Investigation Unit. We've developed a centralized citation tracking log to improve the efficiency of issuing and completing citations, and we're testing tablets for use by surveyors to replace laptops in the fieldwork and increase our efficiency. In addition, we're working very closely with our Office of Legal Services within the department to prioritize regulation packages. The packages that we have prioritized for issuing in 2015 include clarifying the terms for reporting of adverse events, clarifying requirements for change of owners of licensed skilled nursing facilities and hospitals, providing regulations for the medical information breach process, and developing prescribed training curriculum for skilled nursing facilities for dealing with residents who are lesbian, gay, bisexual, transgender. The committee asked a question about the status of the report required by the trailer bill. That report is still under review. The question regarding Los Angeles County says that should Los Angeles County receive approximately 33% of the LNC budget, given that 33% of the facilities are in Los Angeles County? We would remind you of the way that we calculate our estimate. The number of facilities is only one input into the estimate methodology. And it does matter what the types of facilities are, because different facilities have different periodicities for survey and recertification workload. And complaints and ERI workload do not track on the number of facilities. So, for example, Los Angeles County has a disproportionate number of the home health agencies in the state. However, half of the federal recertification workload for a home health agency is completed by an accrediting organization and not by state or Los Angeles County staff. And based on data from our estimate, last year Los Angeles County received approximately 15% of the complaints and ERIs and accounted for about 20% of the total state workload. So you can't draw a straight line from number of facilities to percentage of workload. All of the factors that we put into our estimate go into figuring out the proportion of workload. The governor's budget proposes increased funding for LA County, but only the highest priority workload. That is correct. We are only proposing at this time to fund Los Angeles County for Tier 1 and Tier 2 workload and complaint and ERI investigations. The federal Tier 3 and Tier 4 activities that are not funded in the BCP consist primarily of increased frequency of recertification surveys and initial certifications for certain facility types. This Federal Centers for Medicare and Medicaid Services do not fund the state, including what we might pass on to Los Angeles County, for conducting Tier 3 and Tier 4 workload, and therefore statewide we conduct very little of this workload, so that is not unique to Los Angeles County. We will hold Los Angeles County via our contract negotiations, which are ongoing, accountable only for that workload for which we fund them. And ultimately, the responsibility for any workload that we do not contract with and fund Los Angeles County for the responsibility for that workload falls to the state. We believe that contract language can be crafted to allow modifications to the contract midterm if Los Angeles County's salary rates change. We did not have a provision in the current contract that would allow this, which is why we could not address changes in salaries in Los Angeles County during the period of this current contract, but we are looking at including language in a new contract that will address that issue. Concerning stakeholder involvement, as I mentioned earlier, we've had 3 all-stakeholder meetings since September. We had one in September, another one in November, and we just had one in February. We are now on a semi-annual track for that. We have developed a web page on our internet. It's specifically for stakeholders. We have posted there our work plan for addressing the Hubbard report. We post our performance metrics there. We have a mailbox dedicated to stakeholders where they can submit questions and comments, and we are posting our quarterly metrics.